Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Thanks for checking in with Monday Health Minutes. Today we're diving into a topic that has dramatic impact on outcomes for health. We're talking about genetic testing in OBGYN care. Dr. Stephen Brumfield with Valley Health is exploring this topic with us today about why it's so important, how it can make such a difference in our health. Thanks for being here today.
Thanks for having me.
Let's talk about what genetic testing is and why it can be so pivotal in women's health.
So genetic testing is simply looking at specific genes to determine what things you may be at risk for. And there are really two primary roles for this. One is related to pregnancy, and the other is related to risk of cancer.
Okay, so let's talk about what the testing encompasses. How does the testing go about? Is it a blood test? Is it a different kind of test? And what kind of conditions can it help screen for?
Yeah, so these are blood tests. All that we do these days are blood tests, both the pregnancy and the cancer-related screening. Usually involves receiving some genetic counseling first. Folks can be referred to a genetic counselor, but most of the time physicians are able to do that counseling so people understand what kind of testing they're having. In regard to cancer, we're looking for genes that predispose folks to a high risk of cancer. The classic example is the BRCA gene, which poses a high risk of breast cancer and ovarian cancer.
So should anyone be talking about these tests, or is it more specific if you have family history, or who would this be most likely to benefit from?
Generally speaking, these are folks who are at some increased risk, usually based on personal or family history. For instance, if someone's actually had breast cancer, ovarian cancer, or uterine cancer, colon cancer, then these are some folks that we may want to explore the possibility of testing. What's probably more common, and hopefully, we're able to catch it before they develop cancer, is women who've had a family history of these same cancers.
Right. My mom had it, my grandma had it, and I'm worried.
Correct.
And so you would take that information to your physician and proceed with that. Once you get the test results back, what can we do with this information? How can it help us kind of change the outcomes?
Right. And so it's important to understand that having a negative test, if you have this testing done, doesn't mean you will never get breast cancer or uterine cancer or colon cancer. Alternatively, having a positive test doesn't mean you will definitely get these cancers. It's really just about trying to determine risk. So there's some few strategies that we can do, and depends on specific genetic condition that you have. For instance, we can watch much more closely for breast or ovarian colon cancer. In some cases, women may choose to have a procedure done to reduce their risk of, say, developing ovarian cancer.
Okay, so maybe more frequent screenings, maybe more frequent instead of maybe a PAP annually, maybe every 6 months, something along that nature?
Correct, yeah, okay. Yeah. So we do, for instance, breast cancer screening, mammogram alternated with MRIs, maybe twice a year. With ovarian cancer, you can look with ultrasound. For those that are at high risk for colon cancer, they can do screening much more frequently.
If people are just concerned in general, like maybe they don't have a family history, but breast cancer or ovarian cancer is something they're really concerned about, could they have the testing electively?
You can. Under those circumstances, usually insurance is not going to cover the testing, but it's still available.
And what would be your best advice as women move forward with this, if they do have a family history or if they're concerned about genetic testing?
So first of all, know your family history. We often get folks who, I've had somebody with breast cancer, but I don't know how old they were. And, so know your family history as best you can. And secondly, bring it up to your OBGYN or your primary care provider to say, I've had this pretty extensive history in the family. Is there a chance this could be genetic? Is there some testing we should look at? Do I qualify for this? And so on. So communicate with your provider and know your own risk.
And use that information to make educated decisions about how you want to pursue your health.
Absolutely.
All right, Dr. Brumfield, thank you so much for being here and shedding some light on genetic testing, a great topic. Thank you.
Thank you.
Thanks for checking in with Monday Health Minutes.